Good morning. It is a distinct pleasure to be here today with all of you. Before I begin, I want to thank Marie Latulippe, the study director, and her team here, as well as the full committee. I was asked to focus my remarks today on the topic of WIC nutrition education, which I'm happy to do, as nutrition education, as well as breastfeeding counseling, is often cited as pivotal to WIC success. WIC's nutrition education programming is designed to emphasize the relationship between nutrition, physical activity, and the health of pregnant, breastfeeding, and postpartum women, infants, and children. In tandem with the food package, prescriptions, and referrals to services, WIC provides a unique system of support. Providing nutritious foods is fundamental, and the work being done by this committee is essential to ensuring that the right mix of foods are made available. But that is only part of the effort to support participants, and moms in particular, in integrating these foods into their daily diets to support their health and the health of their children. We know that education is not a simple transfer of information. Effective education happens in partnership and relies on trust. This requires tailoring of information and materials to be culturally relevant and meaningful for each individual. We also know that new moms and moms of young children, particularly those with limited resources, are a vulnerable population. Choosing and serving nutritious foods is not always the easiest option. Education programming and breastfeeding counseling therefore also serve to empower moms to act on the knowledge and to make these healthy choices. Ultimately, we hope that WIC participation has long-term impacts that are achieved through education that fosters the formation of healthy habits that will continue beyond any one person's participation in the program itself. Let's see if I can find that. So at FNS and in the Office of Policy Support where I work, as well as in the WIC program, we have a large portfolio of research that helps us, as well as the broader WIC research community, many of whom are with us here today, understand the nutrition education components that are so critical to the WIC program. We rely on research to understand who we are reaching, how the education is received, and the impacts that it has. These research efforts are vital for ensuring that the programming provided continues to meet the needs of our participants and is keeping pace with the best nutrition evidence and the best scientific evidence regarding educational practice and behavior change. So this morning, I will share just some of the findings, a sample really, from various studies that were recently completed and some that are still underway. Rather than reviewing a list of studies one by one, my hope is to convey how these various research efforts speak to, describe, and inform the goals of the WIC program and support its mission to safeguard the health of low-income women, infants, and children. So I won't go into detail about each of these studies, but they're listed here to illustrate the range of research, either recently completed or currently underway, to document and evaluate nutrition education and breastfeeding support practices, as well as to measure, to the extent possible, the impacts of these efforts on dietary behaviors and health outcomes. So I'm going to begin with talking about what we know with respect to nutrition educators. And it's important to begin with them because we cannot underestimate their role in not just conveying information, but in supporting WIC participants in choosing and implementing practices and strategies. Even at a time when we are exploring technological alternatives to in-person interaction, the nutrition educator is key in developing materials that are relevant and accessible. In order for them to be effective, they must be highly qualified and well-trained. And perhaps equally important, they must have the skills to establish rapport and build trust and trusted relationships with their clients. And we know from the WIC nutrition education study that the educators in the WIC program are highly qualified. Excuse me. Over half of the nutrition educators have worked with WIC for at least 7 years, which is really impressive in this current era where people move through jobs quite quickly. 51% have a bachelor's degree, and 10% have a graduate degree or higher. The data from the study also shows the different kinds of training provided to WIC nutrition educators over the past 12 months. It's interesting to note that there is a real mix here that includes substantive training on nutrition topics such as prenatal, infant, and child nutrition, and a number of trainings that develop the skills of educators to work with participants. So you also see trainings on being a skills participant or learner-centered education, motivational interviewing, and emotion-based counseling. And of course, you see the most common training provided in the previous 12 months is on breastfeeding. As the breastfeeding policy inventory documented, a high proportion of WIC staff are trained in breastfeeding promotion. This includes not only the peer counselors and breastfeeding coordinators, as one would expect, but also clerical and support staff, nutritionists, and others. Almost all state and local agencies reported that staff are trained on using food packages to promote breastfeeding, both exclusive breastfeeding and in combination. Educators have embraced the approach of individualized nutrition education that is tailored to meet each person's needs. In the interviews with site staff, they emphasized the need to engage with participants and listen more, encouraging the participants to do more of the talking. And as you can see from this quote from the study, I came from the old school of, here I am, Miss Nutritionist here, and I'm going to help you by telling you what you need to change. We know that doesn't work. It really doesn't. We need to sit back in our chairs and listen more and talk less. And so these ideas are becoming pervasive in the minds of those working in nutrition education in WIC. And this chart reflects the fact that one-on-one nutrition counseling was the primary delivery method for WIC nutrition education. It's also worth noting the variety in methods employed. There is clearly a move toward using technology creatively and identifying effective technology-based educational strategies. Breastfeeding advice is an important element of these exchanges. WIC staff are a very important resource for breastfeeding information for WIC participating women. WIC staff are the second most common group that women spoke to about breastfeeding, as identified in the infant-toddler feeding practice study. This is from the prenatal report. 68% of women reported that they spoke with WIC staff. 78% of women conferred with their husband or boyfriend about the decision, and smaller percentages, as you see, spoke with the others listed. Irrespective of who they turned to for advice, over 80% said the advice was important to making a decision. The majority, 72% of prenatal women receive breastfeeding information from WIC. After the prenatal visit to WIC, the majority of women are aware of the exclusive breastfeeding package, and about half know about how the quantity of formula varies with breastfeeding and the baby's age. 72% of prenatal women say they received information on breastfeeding, whereas 92% receive information on diet. In this analysis that was conducted with the data from the infant-toddler feeding practice study, we can see the various factors associated with a mother's intent to breastfeed. While many different factors are salient, including past experience with breastfeeding, so some breastfeeding history, the level of education, and the perceived benefits of breastfeeding, and that's captured in that belief benefits index. Another factor with a significant and positive relationship to intent to breastfeed was speaking with more than one person about breastfeeding plans. This underscores the important role that breastfeeding counseling and support provided through WIC plays in mom's decision-making. And this is really what quality nutrition education is about, empowering participants to make healthy choices, to feel that they have the information that they need to be confident that they are doing what is best for their health and their child's health. And so much of what I've been describing reflects and illustrates how WIC has implemented these different initiatives over the past 10 to 15 years. The Revitalizing Quality Nutrition Services Initiative, RQNS, the Nutrition Education Guidance that was issued in 2006, and VENA, the Value Enhanced Nutrition Assessment Guidance. One of the questions driving our nutrition education research is to observe how the guidance on the principles articulated through these initiatives are taking shape on the ground. And results from the nutrition education study shows that WIC clinics nationwide are embodying the principles of RQNS and VENA. Local agencies and sites are incorporating the 6 elements of effective nutrition education described in the 2006 guidance. Sure, there's variation in how elements are used, but that reflects the significant flexibility afforded to state and local agencies in recognition of the diverse needs of the population that WIC serves. One indicator of the successful integration of these ideas into practice is the focus on goal setting. About half of sites reported goal setting with participants. As this person quoted puts it, rather than just laying down a goal for them, what I think you need to change, telling them that, it is definitely important to talk with them about what they want to change so they have a more vested interest in it. The nutrition education study found that WIC staff members are striving to provide nutrition education that is individualized and tailored to the needs of each participant, with participant involvement throughout the process. In the interviews with site staff, they emphasized the need to engage with participants and listen more rather than telling them what they should be doing. They also reported that they adapt their counseling styles and content and the way they use reinforcement methods to fit the unique individual needs and circumstances of their participants. Individualized nutrition education is one of the primary goals of RQNS and VINA, and this study shows there is buy-in and action among nutrition educators to achieve this goal. The WIC breastfeeding policy inventory also provides insights into how these approaches are integrated into breastfeeding support. In particular, nearly all state and local agencies provided individual breastfeeding counseling. At the same time, we found that agencies are using a diverse set of services to promote and support breastfeeding. You can see some of the different variation here, including a breastfeeding promotion kit and enrolling in various programs. We're also working to support innovative ways to better reach participants with nutrition education messaging. The USDA Center for Collaborative Research on WIC Nutrition Education Innovations at Baylor is one example of this. There were 4 projects that were funded. These are just a couple of examples, and the first one is from a recent publication. There are others here who know this particular endeavor far better than I, I'm sure, but it provides a really nice example of some of the terrific research being conducted by this community of scholars. The first bullet tested the effectiveness of web-based nutrition education. The findings demonstrate that both in-person and online nutrition education were effective in increasing breakfast-related knowledge among WIC participants, and also in behaviors such as reduction in breakfast skipping and improving other breakfast-related behaviors, showing the potential usefulness for online education modalities for future WIC services. In other words, the education provided went beyond increasing participant knowledge and understanding. It led to behavior changes and did so in both formats. This kind of innovation is particularly important as we work to improve the responsiveness and relevance of WIC to those who may prefer and sometimes have more ready access to technology than in-person settings. Another project is testing a texting intervention designed to provide both breastfeeding education through an automated texting schedule and to improve communication between WIC mothers and breastfeeding peer counselors via an affordable two-way messaging platform. And we're seeing in all different venues that this two-way text messaging is becoming a really critical link for many people to have communication that meets their needs and suits their personal preferences for how they want to communicate and share with others. This intervention was designed to be used as an adjunct tool by breastfeeding peer counselors to support exclusive breastfeeding. So these are just 2 of the examples from this innovative effort, and there's a conference that we're all looking forward to in July where we'll learn more about the results. Similarly, the Small Grants Program at UCLA to understand the role of WIC in improving periconceptional nutrition is supporting a number of research projects to focus on the role that the WIC program is playing and can play in improving nutrition education in preconceptional and periconceptional between pregnancies in those periods. Many of the projects funded by the grants program at UCLA are also testing how innovative technologies might provide more effective means of reaching participants and providing them with tools that they can use to support healthy behaviors. These are just a couple of examples out of the 7 projects that were funded. The projects are in various stages, and we expect will lead to many publications that will further build the evidence base on this subject. And we also expect to have a final report next spring. We can also observe behavior change through long-term trends. So the WIC participant And program characteristics reports provide some benchmarks for this and provides a lens to view these shifts in breastfeeding initiation rates in particular, comparing 1998 to the substantial increase that you see by 2012. And by the 2014 WIC participation and program characteristics report, we found that the proportion of breastfeeding women now exceed the proportion of non-breastfeeding postpartum women in WIC. And so that's a true piece of evidence to show the success of these efforts. The contributions of the broader research community, many of whom, as I've indicated, are here today, are vital for demonstrating the progress being made on the prior changes to the food package, complemented by these ongoing improvements in the delivery of nutrition education and breastfeeding counseling. And so these are just some highlighted findings that help us to track the changes over time with respect to the improved WIC packages, and we expect that this will continue to shift over time with the next round of guidance. And we see here that increased consumption of whole grains, fruits, and vegetables among WIC participants was observed in the study in California. It noted an increase in consumption by more than 50% of whole grain foods and in vegetables by 20%. In addition, the number of WIC participants who drank whole milk decreased, accompanied by increases in the consumption of low-fat milk. And this is a 2013 CDC study that reported that WIC may have contributed to the recent significant downward trends in obesity prevalence for low-income preschool children in 19 states and territories. The changes in the WIC food packages have resulted in increased access to nutritious foods, including whole grains, fruits, and vegetables in smaller markets and convenience stores. For example, the availability of whole grains increased by almost 30%, according to a study in Connecticut. This is especially relevant for stores in low-income neighborhoods where there can be challenges finding healthy foods. While it is not always easy or even possible to tease out the contribution of nutrition education and breastfeeding support services toward these specific impacts, this research helps us to document and better understand the role of education in ensuring that WIC participants get the full benefit of the program, which goes beyond the package itself. As we all know, making healthy food available is only part of the process. Adopting behaviors and habits that integrate those foods in one's regular diet takes a diverse array of support services tailored to meet the needs of individuals. We are excited about the research that we currently have underway. There are a number of different channels to improve our understanding of what works in nutrition education, how the diets of participants change over the course of their connection to WIC, and how retailers and other settings can make it easier to choose healthy foods. For example, the WIC Nutrition Education Study, from which I've shared some results from the first report, is currently collecting Phase 2 data. This is a pilot impact study of nutrition education programming in 6 states, and the final report for that is expected in 2017. The infant-toddler feeding practice study will provide a wealth of information as well. Thus far, only the prenatal report has been released, but we anticipate the infant report will be released this fall. This study follows a nationally representative sample of infants who began WIC participation at birth until age 5, and will collect data from all of them, including those who leave WIC, providing us with a good comparison. Caregivers periodically participate in telephone interviews with questions on WIC awareness and utilization, on feeding and childbearing practices, and maternal lifestyle. They're coupled with dietary recalls that will provide detailed information on breastfeeding practices, timing of the introduction of solid foods, and the types of foods that children eat as they transition to toddlers and preschool children. In addition, the study collects the child's health and weight measurements, which will provide critical information on the links between feeding practices and early childhood obesity risk factors. And then finally, I wanted to mention that the Duke UNC Center for Behavioral Economics and Healthy Food Choice Research recently posted their request for applications for innovative strategies that apply insights from behavioral economics to improving the shopping experience for WIC participants, which we know can be a challenging barrier for WIC participants to obtain the benefits. And so finally, I wanted to note that in our research and evaluation plan, which is available publicly on the FNS website, it lays out the anticipated studies that we plan to get underway in the coming year or so. Some examples include those listed here, an evaluation of an online ordering system for WIC foods, aligning food package prescriptions to breastfeeding practice, a program for participant research to enhance WIC services, and consideration of WIC EBT in terms of an issuance and redemption transaction database to understand the nature of the data. And so I wanted to thank you for giving me the time this morning to share some of the research findings on the importance of WIC nutrition education with you. Additional information, including the publicly released reports associated with many of the studies I cited this morning, can be found at our website at this link. Thanks.